Addiction and relationships. How do we repair relationships when alcohol and drugs are involved? Treatment for alcohol and drug problems is far more accessible these days. Most general practitioners and healthcare providers have both the training and resources to spot problem drinking and drug abuse and to offer helpful interventions. In the UK, our National Health Service provides counselling, support services, even detox programs and rehab services. Addiction of all sorts, alcohol, prescription drugs, food, gambling, online addictions, is thought to affect 1 in 3 of the UK population. Thanks to a destigmatising of addiction, many of us have a friend or a family member in recovery. What happens though when a partner is affected by addiction? What happens to a relationship when one partner is using drugs, alcohol, or other behaviours addictively? At our practice, we see a large number of couples whose relationship is adversely affected by addictions of some sort. It can be hard to approach in the therapeutic process when the drinking or using partner maintains that they are fine, that the only harm done is to themselves. That's even if they're aware of that. In many cases, the alcoholic or addict seems to function well on the outside. Often he or she holds down a job, pays the bills, and is sociable up to a point. However, we maintain that functioning well at work is a dangerous smokescreen when it comes to relationships and prevents many partners looking at their drinking or other addictions and the damage it causes to their personal experience. Figures from the National Health Service Office of National Statistics in 2018 shows that drinking rises steadily with socio-economic status. High earners in professional jobs such as doctors, lawyers, teachers are much more likely to be regular and heavy alcohol users than those on average incomes. There is less statistical information on drug abuse, whether recreational drugs or prescription drugs, among professional people, but the British Medical Association estimates that 1 in 15 medical professionals has a substance abuse problem. And in 2017, the Westminster Drug Project in London set up a square mile health initiative to provide alcohol and drug support services to the estimated 200,000 City of London workers thought to be affected by addiction. But this is just the tip of the iceberg. We see more and more couples here in our practice who are seriously affected by one partner's alcohol or substance abuse. And it's not unusual for this partner to still be functioning apparently well at work, often earning a high salary. But what are the consequences of untreated alcoholism or addiction on a relationship? The effects of addiction can be subtle as well as obvious, but they are always extremely damaging. Often the using partner tells a string of lies to cover his or her addiction. Trust within the relationship breaks down, and partners quite understandably maintain they can't believe anything anymore. There are also the pernicious effects of unpredictable behaviour. We often hear partners talking about walking on eggshells. One partner is constantly defending against the possibility of an outburst. All real communication and intimacy is sacrificed to keep the fragile peace. Of course, there are also the very overt and damaging behaviours that go hand in hand with alcohol abuse and substance addiction. Domestic violence, infidelity, financial mismanagement. Whatever the behaviour, the effects on the relationship are devastating. Is it possible to heal a relationship damaged by addiction? Well, we see couples committed to making a real change to their relationship. The process is a tough one, and often it requires the using partner to make some sort of commitment to sobriety and abstinence. If alcohol or drugs are damaging a relationship, then removing the alcohol or drugs might need to be the first step to repair. In our practice, we work with individuals to help them achieve sobriety, whether through one-to-one psychotherapy, 12-step support group, or a combination of programs. We also encourage the other partner to find a support group. The family support groups such as Al-Anon or AdFam can be an invaluable resource for partners struggling with the effects of addiction in their relationship. In the relationship therapy that we do, we work with couples in active addiction, with those struggling with sobriety or abstinence, and with those now free from the substance itself, trying to heal from the consequence of an addiction. It's a tough process. Couples therapy with addiction requires specialist work. The trust may have been broken many times, and the newly recovering alcoholic or addict must prove to his or her partner that they are working hard on their addiction and that they understand the damage done to the relationship. We encourage couples who are newly sober or abstinent not to just look at the damage the addiction has done, but how they would like their relationship to look from now on. Destructive though addiction can be, recovery and entering relationship therapy can mark the start of a new beginning. If all the resentment, mistrust and anger can be worked through, a relationship in recovery can become a mutually fulfilling and sustaining one.